Let's take this case. A 70-year-old man with Parkinson's disease has been taking levodopa with carbidopa for 5 years. Recently, he notices that his tremor and rigidity reappear about 30 to 60 minutes before the next scheduled dose and improve again after taking the medication. What is the most likely explanation for this phenomenon? The options are A. Drug tolerance, B. Wearing off phenomenon, C. Dyskinesia, D. On-off phenomenon. Guess the correct answer. The correct answer is B. Wearing off phenomenon. Let's look at the explanation. At the beginning of treatment, levodopa lasts for several hours and symptoms such as tremor, rigidity, slowness stay controlled until the next dose. But as the disease progresses, the brain loses more dopamine producing cells, so it cannot store dopamine well anymore. Now the body depends directly on each dose of levodopa. How does levodopa act? Levodopa enters the blood, then crosses the blood-brain barrier, reaches the brain and produces action. Meaning, when drug level is high, the symptoms improve. But when the drug level is low, less drug in the brain and symptoms return. So the symptoms correlate with plasma drug levels. Wearing off is a predictable return of symptoms before the next dose. It occurs due to short duration of action of levodopa as the disease progresses. The symptoms correlate with plasma drug levels. So keep in mind, predictable symptom return before the next dose, it is wearing off phenomenon. Why not the other options? What is drug tolerance? Drug tolerance shows a gradual loss of effect independent of timing. What is dyskinesia? These are involuntary movements, not return of Parkinsonian symptoms. And what is on-off phenomenon? This is sudden unpredictable switching unrelated to dosing time. So the correct answer is wearing off phenomenon.